So rule and principle necessary to establish a suitable, a good Beehive Air protocol. So the principles, dosage principle from low to high, we said many times during the conference. We start with a low amount of Beehive Air and less time, and then increase gradually after we see the reaction of the patient. And then more important than this one, it's before you start the Beehive Air therapy, you need to do two big things: to relax the mind and to improve the functioning of the body. So to relax the mind, why? Because the patient, they hear, oh, it's a nice bee house, very interesting, in a forest, in a very nice environment. There are bees, beehives, oh, very, very interesting. So the mind may say, oh, it's interesting, but the subconscious may think, oh, 1 million bees there, they can sting me, oh, anaphylactic shock, and so on and so on. So you need to relax the mind at all levels. And because this may be dangerous sometimes. So you need to explain in detail what is Beehive Air Therapy, how it works, reactions, and possible. They also can give them, like Samuel Ramal showed us before, testimonials, like to see in what other cases it worked very well, to speak with other patients which got healed, and so on and so on. And then you need to explain at the first session, first meeting, how many number of sessions are needed normally, more or less, from the experience with other treatments for other people. And also, to relax the mind and to improve the functioning of the nervous system, it is mandatory to change the lifestyle, because most of the people, they have diseases because they do not respect the rules of lifestyles. For example, they do not go early to bed, they lose the nights, they look to television, or they go to parties, or they have a very stressful life, and so on and so on. So once the sleep is in disorder, or the people are smoking or drinking alcohol and so on, you cannot get good results with Beehive Air Therapy. So you need to change the lifestyle. It's mandatory to change the lifestyle. And then in order for the lungs and the respiratory system and the rest of the body to absorb very well the Beehive Air substances, you need to have the body clean. And before having the body clean, you need a very complete, like a complete diagnostics at all levels. I see diagnostics, not diagnostic, at all levels. We discussed several times about this, because if you know the diagnostic, you know the causes of your problems. If you know the causes of the problems of the patient or yourself, then you can act to make a treatment protocol. Okay, so then usually the next phase, it's in almost all chronic diseases, and people, adults or old people, the next phase, it's almost mandatory, is detox. And detox can be done at various levels. To detox, to clean the liver, the kidneys, the lungs, because the lungs also are eliminating a lot of volatile toxins from the body, especially from the large intestine. And also you need to clean the skin. And there are many different naturopathic protocols, natural treatments, and so on, to detox the body. There are big books like this one only on detoxification. And then after you clean the body, you detox the body or that tissue or organ which you need especially, then you can have better results with phytotherapy and aromatherapy, because on a clean body, the medicinal plants and essential oils and so on, they work much faster, much better. And then you work for regeneration. So apitherapy for regeneration means here bee pollen, bee bread, royal jelly, apilarnil, honey, more amounts, so to help the regeneration of the structure of the body. Okay, and of course, in all this time, nutrition is fundamental. Nutrition and lifestyle, they are like 90% of the success. If nutrition is good, lifestyle is good, you only need to focus on 10% of the problems, and then you'll get good results. So when to do the Beehive Air Therapy? In the morning between meals, or in the afternoon also between meals. So do not go for Beehive Air Therapy too close to the meals, because when you eat something, the food comes into your digestive system, let's say in the stomach, and then most or a lot of blood from your body will go to the digestive system to help the digestion. So it will be less blood on the lungs area, on the heart, cardiovascular area than before. That's why it's not a good idea to go to take a shower, a hot water shower, or to go into sauna, when you have eat it. So you eat a lot, then you go to the sauna, you may have a collapse because the blood is on the digestive system, and then it goes to the skin because of the heat, and then it's not enough blood in the center, in the heart, and in the brain. So these are the general rules, and about how many sessions and how much to do it and so on, Beate will speak a bit later during our conference.